Calcium channel blockers are used in the treatment of hypertension and angina. The mechanism of action dilates coronary arteries, reduces oxygen demand on the heart, and decreases heart rate. Side effects include constipation. Angiotensin-converting enzymes, referred to as ACE inhibitors, are used to treat hypertension and congestive heart failure. The mechanism of action prevents the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 causes vasoconstriction and fluid retention. Side effects include cough. If the cough is persistent, try another ACE inhibitor. Angiotensin 2 inhibitors are used in the treatment of hypertension and congestive heart failure. The mechanism of action inhibits angiotensin 2 and reduces vasoconstriction and blood pressure. Beta-adrenergic blockers are used to treat hypertension and angina. The mechanism of action inhibits the action of the beta receptors on the heart. Some are selective for the beta cells only on the heart, while others are non-selective and can act in other places within the body. An example, the lungs. Side effects include hypotension, bronchoconstriction, and dizziness. These agents should be used with caution with asthma patients.